Now, World Cancer Day is celebrated every year on February 4th. It's a global uniting initiative led by the Union for International Cancer Control, UICC. The theme for World Cancer Day 2021 is I Am and I Will. Cancer is the second leading cause of death globally. This year is a reminder of the enduring power of cooperation and collective action. Joining us now is Dr. ENIOLA AKINTUNDE, CEO, founder, Niola Cancer Care Foundation. It's good to have you. I presume you're a doctor. I hope I haven't given you a title that...
Of course, you're giving me a title.
Okay.
You're giving me a title. I'm not a doctor. I'm an advocate, and I'm going to speak from the human angle.
Okay.
We have a doctor.
Please go ahead. You were making a sentence.
Okay. Can you hear me?
We can hear you clearly. Yes, we can.
Okay. We have a doctor who is a co-founder, who is part of the NGO. His name is Dr. Adetapo Shinowa, but the time is short. And he's extremely busy. But
we're happy to have you. We're happy to have you. So please, could you help us with the mantra for this year's World Cancer Day? I am and I will. Break it down for us.
Yes, I am and I will means that we are committed. We are committed to the fight. Power to continue the fight against cancer, support advocacy, create awareness, educate people on cancer awareness.
All right, let me quote you, ENIOLA. The scourge is neither beautiful nor gorgeous, but cancer isn't a death sentence. What's the real essence of this statement?
Yes. Yes, that is my own statement for this year for cancer, because I'm sure you must have known someone who had cancer or someone who has died from cancer. The is gorgeous, but the picture that Nigerian Cancer Society, the association that's one of the biggest associations in West Africa, who oversees the advocacy and education on cancer with Nigerian Cancer Society, the picture they did for me this year, I looked at and then I asked myself, this picture is so beautiful. Is cancer beautiful? Is cancer gorgeous? No, it is not. It is not. We all know that it is not. But at the same time, it's not a death sentence. And that is the message I want to give the whole world. I want to give to our... Yes, cancer is not beautiful. Cancer is not gorgeous, but cancer is not death rate. It is not death rate when it is picked early. It is not death rate when the diagnosis is accurate. It is not death rate when the treatment it is not death rate. But unfortunately, that is not the case. It is not the case with Nigerians. It is not the case with most cancer patients. Most times, by the time they discover, or by the time they picked up the disease, it has far gone.
Okay. ENIOLA, I just want to pick up on what you said, that it's not gorgeous. But what I found to be gorgeous is the tenacity of people who fight alongside even the cancer survivors themselves. In many cases, there's something gorgeous about the human spirit in those conditions. But I just want to ask you, if I may, what's the story? What's your own personal journey in becoming an advocate for cancer victims?
I've shared my story repeatedly, and I'm going to share it again. And I lost my husband to colorectal cancer in 2013, and I never heard about colorectal cancer before then. I've never heard about colorectal cancer, not until... But then he was being treated for, I think, malaria. Yeah, malaria. Then later it was typhoid. They were treating him for misdiagnosis, mismanagement. And eventually he died in India. And the experience was not a beautiful one for me. It wasn't. And it was the end of the road for me. This is somebody that in the university, and is somebody that loved me so much. And we went through a lot together, and lo and behold, he was sick, and I thought it's something normal, that is going to take malaria drug and he will be fine. And we started the battle, and within 1 year, I even compared his case to what happened to this guy we lost last year, Chadwick Boseman, who was an American actor. And if you can remember his
Yes.
case, yes. Yes, Chadwick, the cancer was discovered, I think, at the age of 39. Despite that, his disease was far gone because he was in a country, he was in a better place that he had access to good health care and he was managed very well. But my late husband, when he be- and my late husband bedridden till he died in 2013. He couldn't achieve anything again. He couldn't stand up. He couldn't take care of himself. He couldn't even eat. But here is Chadwick in US, an actor, an accomplished person, a celebrated person, was able to, despite the fact that he was diagnosed of colorectal cancer, same stage that my late husband was. Cancer was also diagnosed. So those are the things we are talking about. That is why we are advocating and we are calling the government. That's what I said. I said we won't keep quiet. It's a conversation that will continue. We have to keep pressing. We have to keep holding our leaders, holding ourselves accountable. Every hand must be on deck. And we'll keep talking to Nigerians. We keep creating awareness on cancer because there is a lot of misfortune, which I also experienced that, and I was also like that when my late husband case started. I remember there was a doctor that actually told me at the initial stage that he's suspecting my husband had cancer, and I said, no, it is not his portion. It can have cancer, but lo and behold, Bola had colorectal cancer.
Of course, you
And then
didn't want it to be, it was something you didn't want to be identified with your family. What a harrowing experience it must have been for you, Niola. Our heart goes out to you. But talk to us about the place of awareness, education, accurate and early diagnosis, as well as early treatment and access to quality and affordable health care.
Sorry, can you come again? I missed that.
Yeah, so talk to us about the place of awareness, education, accurate and early detection or diagnosis rather, then early treatment and access to affordable health care.
Yes, there were estimated 1,115 new cases of cancer in Nigeria every year, and 78,899 deaths annually. Cancer every year. Cancer alone, we are not talking about other diseases. A huge problem, a serious problem that we cannot afford to fold our hands, despite the fact there's COVID-19. Because in fact, because of COVID-19, all attention now is on COVID-19. So there's serious distraction, serious on cancer education, awareness, advocacy, treatment, management, and control of cancer. And that is what I want to use this opportunity, this word cancer, to tell the Minister of Health, everybody, our frontliners, our doctors, advocates, we should not give the advocacy, the talk, the awareness. We must continue to do it. Where we are talking, yes, I'm not
Here we
saying,
are. This is me.
I'm not saying that.
All right, Eniola, thank you so much. We wish you the best as you advocate.